The problem is, it's very hard to predict which patient is going to go have a recurrence. We know that the older you are, the poor diabetic, the obese you are, and if you already have a heart failure, the risk of developing atrial fibrillation goes up. So the other thing we talk about in atrial fibrillation is what is your pumping chambers doing? Atrial fibrillation can cause heart failure, and now there is a lot of data and impetus towards what we call arrhythmia-mediated cardiomyopathy. We all know that atrial fibrillation causes stroke, but because your heart is not in a regular beat, think about your bottom chamber. Your bottom chamber is sometimes slow, sometimes fast. So this irregularity actually can itself promote what we call LV dysfunction or left ventricular dysfunction or called heart failure.
So
So
the heart becomes weak.
the heart becomes weak, and if you don't treat those AFib, they will behave just like any other heart failure patients.
So if you treat them, the heart function can improve, it can get stronger.
Mostly if it's purely based on tachyarrhythmia or the fast heart rhythm related heart failure, the moment you restore the rhythm normal by cardioversion, by shocking, or by ablation, or by medications, those heart failure usually reverses completely.